Assalamu alaikum. Welcome to NTV Europe's weekly chat show, Talking Point. I'm your host, Syed Neaz Ahmad. In our studios today, we have a medical personnel who has spent several years of his life towards community health. He is Dr. Raja Gangopadhyay, a consultant obstetrician at West Hertfordshire Hospital NHS Trust. He has previously worked with the Royal Free, UCL and other places. His special area of interest is obstetrics, obviously, but sub-interest is perinatal mental health and also benign gynecological conditions. If you don't understand that, nor do I, and that's why we are going to talk to him. Welcome to the show, Dr. Raja.
Thank you very much indeed for inviting me.
Well, it's a pleasure to welcome you here, more so because you have traveled all the way across the city from Hertfordshire all the way from there, and you could make it. It's great. Dr. Raja, how did it all begin? Why did you decide to become a doctor rather than a chemist or a cricketer or something?
At some point in my life, when I was quite young, in my school days, at some point I was quite unwell. Mm-hmm. I come from a family who no one has first-hand experience or expertise in healthcare. So then, throughout the journey, I actually have seen the different pros and cons, how the doctors interact, how the not only doctors but other allied healthcare professionals they interact. And since then I realized that how it is important that when somebody is in need, somebody is suffering, so important to go out and reach to them in a way, in a language they speak. And that is why throughout my career, I always believed in linking with the lay members of the public who doesn't have the knowledge about medical conditions.
You are referring to the sad state of affairs of doctor-patient ratio.
Not necessarily so. It is about how we communicate with the lay members of the public, lay members of the people. And in layman terms, because someone is suffering, we have to go out, and that is how we engage with them, how we support them, how we reassure them. So each and everything is important. It is not only about the exact treatment I'm giving, but the holistic approach is very important. Right. How we approach him or her as an individual. So that is why it is so important.
And it's also the team, isn't it?
Absolutely.
Rather than the doctor himself.
Absolutely. It is a teamwork. If what we call as a multidisciplinary team, I cannot provide all the care someone needs myself. Yes, I often, as a consultant, I often lead the team. Right. But yes, we need expertise and experience for everyone involved in healthcare. And to some extent, I feel it's a whole society needs to get involved. If someone is not well, it is a responsibility of the people surrounding her as well to come forward and support.
Right. Well, I'll just read out something from what you have said before. I strongly feel that psychological care during pregnancy is very important for all moms throughout pregnancy and beyond, irrespective of their mental health history and the outcome of the pregnancy. Now, the question arises, why perinatal health or aspect is so important in perinatal mental health?
Probably the most important thing is, sadly, even in the countries, developed countries like UK, mental health condition still has remained one of the leading causes of maternal death during pregnancy and up to 1 year of childbirth. So this should be obviously keeps mental health in one of the top priority. If you look
at this number of deaths, is this a matter of great concern, like that of prostate cancer or something?
Well, overall, the death, we are very fortunate to live in this country where the maternal death is very low because of a very high standard of care in our maternity services. But sadly, still, this is one of the important causes of the mothers who die. This is one of the important leading causes of maternal death. So that is why this is definitely an important cause. And some other factors are also important too, is when someone is pregnant, and mental health condition outside pregnancy is slightly different from when someone is pregnant. And that is why, as an obstetrician, I strongly feel that we, as a direct, involved
This
in
physiological changes in the body of the pregnant person, is it causing all the problems?
we don't know why it happens. It may be there are a lot of theories around it, but whatever be the cause, if someone is persistently feeling low, anxious about it, or have mental health condition, that needs to be treated, because it not only affects the quality of life of the mother, but it can affect the baby, growing baby as well, because there are a lot of very strong evidence to suggest that it can lead to the growth restriction of the baby, it can lead to preterm delivery of the condition, and also there are complications with the prematurity as well, is higher in this group of population, and that is why it is so important. And also it can lead to some impairment or difficulty in bonding and attachment with the baby. And that now there is very strong evidence to suggest that it can lead to long-term development of the child for initial few years.
Is this perinatal mental health related to like the first child, the second child, or third child?
Not necessarily so. It can happen in any pregnancy. In fact, actually outcome of the pregnancy as well. For example, sometimes, very sadly, some mothers...
Are you talking about whether it's a male baby or a female baby?
Not necessarily so. It can happen in any pregnancy, irrespective of the outcome of the pregnancy, because very sadly, sometimes mothers may not end up in having a live baby, or for example, it might end up in a miscarriage or stillbirth, or baby might even sometimes lose their child when in early years as well. So it can anyone is susceptible. So that is why I always keep on saying that it is important for everyone. And also there are some serious mental health condition as well. What we always worry about healthcare professionals, such as postpartum psychosis or severe postnatal depression. Over 50% of cases it can happen even someone doesn't have a mental health problem. So that might come as a surprise to them. And sometimes that is why there is a denial sometimes, and people often feel that, oh, I didn't have any mental health problems, so I cannot develop. But it is one of the time when it can happen.
What triggers it? You do not know. We don't know.
We don't know why it happens, but obviously there are some risk factors or contributory factors.
Like we were talking about it previously, the cultural factors, somebody coming from a different culture to this country, and maybe be the environment, maybe the language, maybe the communication causes the problem and they cannot get along. Maybe their loneliness, you see. Here they may not have the facility of a grandmother or a grandfather or a maternal grandmother or grandfather, like that, see.
Yeah, you are absolutely right. Support, those mothers who do not have necessary support, they are definitely at slightly higher risk. And you mentioned very rightly so, is the cultural impact. It plays a huge role. In my experience, I have seen mothers who have come throughout the middle of pregnancy from another country, and they find a completely different environment. The whole the way we treat patients, the whole service development is completely different. So there is definitely a cultural shock that can significantly contribute. And also, if someone had mental health problem even before pregnancy, they are at higher risk of developing mental health problems. One of the challenges we face is when someone is pregnant, sometimes they stop medication because of the fear that it can harm the baby. With the information from the Royal College of Psychiatrists, it shows that 7 out of 10 women who stop medication can have relapse. So that is why it is very important that you should not stop the medication when you are pregnant immediately without medical advice and supervision. That can be quite harmful to you, for the fetus as well. So that is why it is very important that even if you're on medication, or even if you are on treatment on something, you should seek medical advice as soon as possible. Ideally, if you have a mental health condition, it should be under control. You should seek advice before while you are planning pregnancy, if possible. That is your advice. But we know that over 50% of cases pregnancy is unplanned. It can come as a surprise. But that should not be the end of the world. There should be still advice. It is still not too late. Whichever stage of pregnancy you are, if you realize that you need to seek help, you should seek help. And that is probably the key point.
Well, in the West, people are, they don't have as many babies as they should. And that's why we have constantly a need of migrations and migratory people. But back in India, Pakistan, Bangladesh and other countries, you see, there is an overpopulation or an excess of population. And there is the same problem we have, or?
Absolutely. It is a global problem. Everyone, I have worked in India. I qualified from India. I did my post-graduation training in India, and I have seen exactly the same problem. And in fact, in countries, the mention about Bangladesh, Sri Lanka, and India, another big challenge is stigma. We talk about stigma even in the UK. But you can well imagine.
Not the stigma of pregnancy, but the stigma of mental health.
Mental health. And that can have impact on pregnancy, and someone is pregnant. So that is why the stigma and taboo is so important, plays a so important factor, even in our society in the UK as well. So you can, I've seen it as a first-hand experience how it affects, and sometimes patients from ethnic minority background, they have.
Okay, sir, we will have to take a break here.
Yes.
Pregnancy, stigma, and taboo. We'll come back after this short break, and then we'll continue the discussion. Thank you. Don't go away.